Welcome, everyone. We appreciate you taking the time to be with us today to talk about a lot of really important subjects and to certainly have discussions about our coaches and student athletes and returning to play and getting ready for the fall. I'm Joni Comstock, and I'm Senior Vice President here at the NCAA. My responsibilities are 84 of our 90 championships, and then several of the external operations areas, social, digital media, media coordination, statistics, and several other areas. So again, welcome, and we are very, very happy that you are with us today.
Good afternoon, everybody. I'm Dan Gavitt. I'm the Senior Vice President of Basketball at the NCAA, and a pleasure to be with you. I oversee the Division I, II, and III men's basketball championships and the NIT championship, and work very closely with my colleague Lynn Holzman in women's basketball, who will talk with you in just a moment. And I've also oversee our corporate relations program, broadcast services, fan engagement as well, and looking forward to talking with you, serve as a liaison with the NABC, the National Association of Basketball Coaches, as well. Thank you.
And good afternoon, everyone. My name is Lynn Holzman. I'm the Vice President of Women's Basketball. Similar to Dan, kind of in the oversight of the championships, myself and the team that I work with, we oversee the Division I, II, and III women's basketball championships. And then other responsibilities I have are a variety of other internal things relative to the national office, as well as serving on a variety of boards externally. I also serve as one of the liaisons with the Women's Basketball Coaches Association. So we're excited to have the opportunity to engage with you today to talk about some issues that have been facing you, our coaches, our student athletes, and our world. So with that, I'm going to turn it back to Joni to get us going.
Sorry, we're having a little bit of a challenge with this today. So I am going to ask Dr. Inline to introduce himself, and then we'll get started with some questions and dialogue, and again, things that we hope will be helpful to you as we look to the fall.
Well, thanks, Joni, and Danny and Lynn. It's great to be here with all the executive directors of coaching. So I'm Brian Inline. I'm a neurologist and the NCAA Chief Medical Officer, and I oversee the Sports Science Institute. So our job really is to really help with all aspects of education and research, and really just membership engagement for health and safety. So it's great to be with you today.
Okay, well, thanks again. And so we talked about preparing and doing this webinar several weeks ago. And the focus clearly was on health-related things. We've obviously, since March, we've been all battling in our society COVID-19 and asking a myriad of questions about how we can help our entire society get back to good health, and certainly, again, support our student athletes and coaches as they look to the future. Since that has happened, we've had some very tragic incidences and sadness in our world. And so we thought that we would actually start with just a little bit of a discussion of that, because it certainly is, I think, of great concern and to all of us. And so, Dr. Inline, we thought we would start with that, if it's okay with you. And if you could talk just a little bit about really the impact of both COVID-19 and the incredible social injustice that we've seen, and I guess further exposed in our society. And maybe talk just a little bit about that, but then also some things that you see that we could do to support our coaches.
Yeah, Joni, thanks for the question. And so, you know, COVID-19, so this is a once in a century pandemic. Last one that we've seen at this level was in 1918, and it's a highly infectious coronavirus. And the one thing, it doesn't discriminate against who it infects, but what we've seen in America has been pretty remarkable. So just, you know, outside of what Joni was really referring to, and with the unrest that's happening in our society, I just want to take a little bit of a sidestep and note one other aspect of COVID-19, and then get back to the heart of Joni's question. So 1/3 of all of the American deaths from COVID-19 have happened in the elderly and nursing homes. And it speaks to the one hand about the vulnerable, but it speaks really profoundly about how we take care of the vulnerable in our society. And so another really striking statistic is that there's been a marked overrepresentation of African American and other people of color who have not only been infected by COVID-19, but have had really negative outcomes. And so that has to do with several factors. It has to do with inequalities in terms of, if you look at where the original testing was done, it was done primarily in white neighborhoods and well-to-do neighborhoods. If you look at the housing conditions and the ability to really contain COVID-19 and to physically distance, it was exceptionally difficult in many African American communities. Access to healthcare was not equal, and there's also an overrepresentation in our African American communities of diseases such as hypertension, cardiovascular disease, obesity, diabetes mellitus. And so it really has laid bare many public health disparities, and including those who have medical insurance, which is, when we think about just being able to have medical insurance, the right to that sort of care. So that really laid bare that. And then another is that the NCAA conducted a survey of 37,000 student athletes. And although in general, we saw that there was a marked increase in mental health symptoms and disorders amongst all of our student athletes, this was most pronounced in our student athletes of color, especially our African American student athletes. And so it really has laid bare some issues that as a society, we need to just take a step back and say, I mean, we knew this existed, but this has made it even more evident, and you superimpose that on yet another unjust murder that took place with George Floyd, and just sort of really the ramifications of that, and looking at social injustice that has been playing out in the United States. It was really like a perfect storm of these events coming together, and I think that, amongst many other things, has led to the demonstrations and really just the protests. What are we about as a society? And I think Dr. Emmer, when he was really one of the first sport figures to come out and make a strong statement, and I think that always speaks to his moral fabric and ethical leadership that he's demonstrated throughout all of this. And many coaches have also spoken up, and we know that our coaches have more influence on our student athletes than anyone else, and so how the coaches understand this and help guide our student athletes and really the sports world, we all just think that's incredibly important. So thanks for leading off with that, Joni, and certainly I'd love to hear the input also from you and Lynn and Danny on this, because it just really is so important that we just get this right. This is a moment, just like COVID-19 was a moment to try to get this right. This is another moment that is even superimposed further on COVID-19.
As you know, I'm very proud of, and you said, Dr. Emmert's leadership, and we've done a lot of things, as you know, within the office to talk to our staff and to have a lot of dialogue about it. And so I guess my hope personally in this is that, first of all, we're going to truly begin to expose the social injustice that has been there for so long and has impacted our coaches, our student athletes, and I'm hoping that sport can be a part of taking the leadership to make this better. But I think it's also a time that we have to be patient with ourselves, take a little time, because it has been, again, so emotional, so stressful, and that, again, I think we appreciate very much your comments to help us think through how we can, again, sort of take care of ourselves while we try to lead our country a little bit.
Thanks, Joni. And Brian, and I concur. I mean, this is just such an upsetting time in our country. It's certainly a time for us to listen with open hearts and open minds, and to speak our minds very authentically, and to hopefully approach this with long-term solutions. Because it was one thing I think that I've learned in the last 10 days in listening is that this is not a new problem. This is a problem that's been around for decades, and maybe there's a greater understanding of that problem now. maybe that's a silver lining in this pandemic, that it's given us the opportunity to focus on something that is unjust and despicable in our society. But it's not going to be fixed overnight, and it's going to have a long-term and a very dedicated approach to something that needs change and has needed change, frankly, for decades. So I think that's all of our hope and prayers and at this time. Brian, I wanted to ask, as we continue this discussion on COVID-19, a question about resocialization. We see that, we continue to see states and communities evolving at different stages of resocialization. Indeed, sports leagues are approaching it in different ways, either allowing things gradually or slowing it down, or indeed maybe not playing at all. Where is the NCAA today with its approach as we approach the fall semester and the start of the academic year?
Yeah, so the biggest difference for the NCAA compared to the NFL and Major League Baseball, NHL, is that our resocialization is intimately tied to the resocialization of the campuses, the colleges, the universities. And what's really important, and we've all been, speaking to, seems like hundreds of conferences and in the last several days. And what's really important is for the coaches to understand that the athletics game plan in this is intimately tied to the university's plan. And the university's plan is completely tied in with the local health officials. So this isn't an athletics run issue, and it's not even completely university run. They have to do it in sync with local health officials, and that includes the contact tracers. So if there's, say, a positive case in soccer, it's not the athletics department that manages that. I mean, they have to have a management plan, but the public health officials are at a place now where rather than everyone being at stay at home, that the purpose of stay at home was that so we could be at a place where new cases, we can aggressively trace them and do what's right, quarantine, and we're having them undergo a testing protocol. It is interesting, schools, even in the same state, may be opening up differently, and that has to do with the readiness of the school. Some schools actually are working very aggressively with the local health authorities and are even helping, like an independent contractor, to bring in more contact tracers that ultimately report to those authorities. Because, you're supposed to have the recommended ratio is 30 for every 100,000 people. And we have in our country about 100,000 contact tracers. We easily need 300,000 to 400,000 if we were to really get this right. So the resocialization, it's tied to the school, which is tied to the local area, and it's happening state by state. There's no one national plan.
So Brian, as you described that, and considerations given at the campus level, as you did, as they work with local authorities, then as student athletes are coming back to campus, and as we know in all of our seasons, there's a variety of sports that are playing. Can you talk about whether sports are going to be treated differently when we think about this notion of getting back to play?
So we first have to just get the summer right. And so we put out two very important documents. The first was just the core principles of resocialization of sports, so moving it in phases gradually, and for each sport they should go through those phases. So that's a sport by sport issue, because you want to make certain that each sport can get it right and within athletics, within the school. When we look at the sports, so you look at basketball, so that actually starts in the summer. So you have the basketball student athletes that will be returning to campus this summer, and we have to think about them long term. When we look at all of the sports, fall, winter, I think they're all. I mean, there's this talk that we're going to have, 100 million vaccine vials ready by the end of the year, but that's a political statement. It's not a reality statement. It would be, if we had a vaccine by the end of this year, it would be nothing short of miraculous, because if you look at the multiple stages that a vaccine has to undergo. The other thing is that we really look at the sports by their risk of COVID transmission. And so you have your really low risk sports, things like riflery and bowling, even swimming. But then you look at your high risk sports, so that includes football and basketball and field hockey, soccer, ice hockey, crew, water polo. And so those sports we're looking at a little bit differently than the much lower risk sports, but no matter what, whether fall from moving into winter, each sport is really going to need to go through these phases in a way that we understand that it can be done properly. And what's very important, I think, to understand is that when we're in phase 3, that doesn't mean we're in the clear. It means that we're doing higher risk activities because our society has adapted to that, but COVID hasn't gone away. And we're still going to have to be ever vigilant. And what sport does is it breaks down a lot of the things that are really necessary to try to prevent the spread of COVID. And so, we can talk about that more, but ultimately it's sport by sport, whether it's fall or winter, we're really taking a very similar approach and doing it by really basically stratifying it by the risk category.
Brian, maybe we could shift just slightly, and as you know, we have the opportunity this afternoon to talk to the executive directors, and maybe you could comment just a little bit about specific things that the coaches associations could think about for the coaches as we enter the fall, and whether it's the variety of sports or but things specifically for them, because again, they obviously care so much and are very, very experienced people.
Yeah, so the coaches association, the coaches, they're really in the best position to influence behavior. And really the bottom line is going well into 2021. We are in a new normal. And so every coach at all times should be wearing a mask. Every coach should be mindful of the fact that they really need to be really careful about their physical distance with athletes, especially when the athletes are panting really heavily, because they've just undergone an intense workout. I mean, it seems strange at first, but if that's not the behavior that the coaches are taking, they're not only putting themselves at risk, but it's also that they're really telling the athletes that, well, it's not that important. And it really is, because COVID is not going away for some time. I think for the coaches, it's also understanding that there's going to be a new norm in what's happening in the training room. That's going to be a place where you can't just walk in anymore like before. There has to be an appointment. The locker rooms are going to be different. They're going to be physically distanced. And the other concept that is very important for the coaches to start thinking about, and so we've actually started to develop this model for football, and it's going to be modeled out for all other sports, is the idea that the athletes are congregating in functional units. So you can think of teams, and let's say football, that there are functional units of say 10 athletes, or you can do the same thing whether it's soccer or others, and that the practices may be a little different, because remember, every time you go into the contact aspect of practice or competition, you're breaking the rules of engagement for how to decrease the spread of COVID-19, because the bottom line is there are 3 things that work. It's physical distancing, universal masking, and the proper hygiene and cough etiquette. Those 3 work better than anything else we know of. And so even when you're involved in all of your practices, and yes, there's a time when that breaks down, but on the sidelines, the athletes should be in their functional units. And when they're not engaged in the practices, they should be masking, they should be physically distancing, they're interacting with other students, because if they're not doing that, they get infected, they can infect an entire team. So this is the reality the coaches should be thinking about, and it's something that should be reinforced every single day, and the coaches are the best role model for that.
Brian, if you don't mind, I'm going to do a quick follow-up question here. You've talked a little bit about that, there are many great values that sport reinforces, and some of them are around being tough and don't ever give up and those sorts of things. And I know that you've talked to all of us about this is probably not the time to do that, and that we have to be careful, and until we get a vaccine or we get a different point in the health of our country, that this is probably not those sorts of suck it up sort of times. And could you talk just a little bit, maybe again for the Coaches Association, how they could think about encouraging the coaches to really to think about that and take care of themselves, and being a different kind of role model?
Yeah, so Joni, I'll give two examples pre-COVID that were really led to bad outcomes about toughing it out or sucking it up. One was for physical injuries. When you do that and you tough it out, and the next thing you know, you have your ACL tear because it should have been attended to way earlier. Or the other is we really learned more recently in mental health symptoms and disorders that when you just toughed it out, didn't have it managed, that it led to a much higher risk of injury and a much higher risk of actually dropping out of sport. So for COVID-19, one of the things we're asking, and it's in our documents for every athlete, but especially for everyone in athletics, and most especially for every coach, is that every day they're doing a daily self-health evaluation, which includes your temperature. And now we're making it that it shouldn't even be more than a honey cough or muscle aches, or feeling achy, or having any new nausea, vomiting, or diarrhea. If there's any new skin rash, if there's any perception of short breath, you all of a sudden have a decreased sense of smell or taste. All of these are potential COVID-19 symptoms. And so it used to be, well, I don't need to sleep, I don't feel well, but I'm going to go in. The new norm is that if you don't feel well, you don't even come near the athletics facility until you have had a discussion with your physician or with the primary athletics healthcare provider who's on site, because the bottom line is you can put yourself at risk, but also a lot of people in athletics at risk. And so that's the new norm, Joni. It's not toughing it out. It's really having a great appreciation for the highly contagious nature of this disease and how that sort of action can really have quite negative consequences.
Brian, thanks. Really valuable information, hopefully, for our coaching associations. Along those same lines, what we're talking about here is stressful jobs that coaches have. And now there's even more stress around COVID-19, around the social crisis that we're experiencing as a nation, and how we can support student athletes in both those challenges in their lives, health and safety and social unrest and inequity. Any thoughts or ideas or strategies that coaches associations can employ to support head and assistant coaches in that stressful kind of environment they're in, about how they take care of themselves and their own mental health and prepare, to lead and educate and engage with their players?
Yeah, in some ways, Danny, it's like this is an opportunity now for us to all take a giant step back and say, why are we doing what we're doing? And it's really an existential moment, and it's at these moments, so understanding, the profound inequities in our society, and understanding that everyone is facing this pandemic together, and so this is really an issue for humanity, and it's at this point in time, especially when our emerging adults, they're looking for leaders, and again, we know from the data that the coaches can lead and influence our athletes more than anyone else. And so I think the perspective can really change, that if I'm going to be a leader, I need to take care of myself. I need to understand this is a different time. The focus is going to be different, and to provide that leadership to everyone on your staff. So for all of the assistant coaches, so that they know what's the priority right now? The priority is that we get this right. And I don't think it's just for our student athletes. It really is for sport. And you know, we've said this so often, but sport is a metaphor for society. Sport's a representation of what it means to be human. Sport is really critical for our survival as a society because it's disability literacy. And so I think it's a wonderful opportunity to just take a step back and put it in a completely different perspective. And that requires a lot of self-reflection and especially self-care.
Thanks, Brian.
Brian, you referenced before some of the physical symptoms, and you talked about those 3 items: the fever, the loss of smell, taste, other things. One of the things you were just kind of referencing that I think would be helpful to hear you dig in a little bit more is that both individually as head coaches, as a head coach works with their staff, their assistant coaches and others and their student athletes. Can you talk a little bit more about the mental health aspect of it and the stress that comes with dealing with the pandemic, and as we referenced earlier, some of the other things that are happening within our country, specifically around the social injustice issues? So some of the signs, symptoms for everyone to be aware of relative to mental health and in particular stress.
Yeah, thanks for that, Lynn. So when we look into the data, and this survey was completed before the marked unrest after George Floyd's death and really sort of the massive awakening in our country that we just can't allow this to happen anymore. So even just before that, there was a profound amount of anxiety. Many student athletes had like the equivalent of low-grade post-traumatic stress disorder. There was an astounding high amount of a sense of hopelessness and not knowing what to do. And how can that manifest? So, you know, sometimes it's just a decreased attention span. Sometimes it's very inappropriate behavior or outbursts. Sometimes it's a sense of being very withdrawn. For many people, it actually was a marked disruption in their ability to sleep normally, which then compounds everything. So, you know, we actually in our documents we called this out and believe that there really should be a special attention in the pre-participation physical examination, that there's special time that is spent addressing the mental health of the student athlete, but I think also the mental health of our coaches. And so it's not just our acute sense of, well, how has this impacted my athletes, especially the athletes of color, especially our African-American athletes, which are not only have been unfortunately overrepresented and you know, the social injustice and the negative impacts of COVID-19, but if we look at some levels of division are white. And then if we look at team physicians, there were more African-American men in medical school in the 1970s than there are today. Issues that we need for the coaches to be acutely aware and to know that increasingly we are being told, you know, you really don't understand me culturally, but I need to be understood. And so I think we all collectively need to rise and do much better in that regard. And some of it is the acute awareness right now. But as Danny said about long-term solutions, the other is, and we actually do have programs in place to try to develop pathways. And I think it's really for our student athletes to have these pathways and to different sorts of careers where they really are on the front lines of managing others, whether it's in medicine or as an athletic trainer or as a licensed mental health provider. So it's kind of all of that combined, Lynn. Yeah.
So Brian, just following up a little bit on that and just kind of going back to the value of the coaches associations right now and the help that they can provide. So would you recommend for the executive directors that they encourage at their meetings, at their gatherings, for the coaches to talk about this and to get their feelings out a little bit? And I mean, is that an appropriate strategy, and should the associations be considering that?
I think it's a great strategy, Joni. You know, one of the things that we've learned, so there are different kinds of what we call psychotherapy, which doesn't mean that you're getting, you know, psychoanalysis where you're on a couch and someone's, you know, interpreting your dreams. It really is any sort of engagement where you're trying to understand dynamics, and group therapy is profoundly powerful, especially when it comes to subjects that one's not necessarily comfortable with. And so it ends up being like a peer-to-peer, and within groups, when coaches discuss this, it really can have a great impact. And with that in mind, the coaches associations might even be thinking of whether there are mediators for coaches in this regard. And so you actually discuss strategies, and to have group strategies as a collective team at a school, or even a collective strategy as an organization, that's really profound.
Hey, Brian, two-part question here for you. First is, what are the key determinants that will indicate sports can safely restart? We've seen a lot of announcements about sport restarting, but when we get closer, what are those key determinants that will determine whether that can actually have, you know, safely happen? And the second part is, what is the real possibility of completing seasons?
All right, hold on. I just got to go in the next room and get my crystal ball here. So, you know, classically speaking, we follow what's called the gating criteria, and we outline this in the first document, the core principles of resocialization of sport. And that means that in community, it really was the state, but it really is important in the community, that the infection rate goes down or continues to go down. And that so for example, we, in New York City, where I've been for the last couple of months, there was no way we could have done sport even a couple of weeks ago, because the hospitals were at 100% capacity taking care of COVID patients. Now, we look at the hospital systems in New York, and they're starting elective surgery next week. You look at New York, which was decimated with COVID-19, our infection rate is the 4th best in the country. We're at 0.7. You know, so we're way below the 1.0 value. And so these are all key indicators. And then the other thing is that we can't be in a rush. And also, when we hear reports that, okay, well, Alabama student athletes tested positive for COVID-19 yesterday, you know, well, good. I'm glad that they were found. I'm glad that they were found at the front end. Not glad they had COVID-19, but that means the system's working. And so they will go into proper quarantine. And so it really has to do with, if sport's going to really work and we're going to finish the season, Danny, it has to do with a couple of things. One is, well, look, this is, you know, what the virus is going to determine that. And since we've never seen this virus before, we really don't know. But what are some of the possibilities? And I think this is a very important concept. Even if COVID-19 is increasing, say, in the country, what's really important for a coach is what's happening in my community. And you can think of a school. Remember, athletics is part of that microcosm. And if you can control that bubble, then you can have a greater success of sport carrying out and doing everything right. All of a sudden, their players are infected. And so it in part depends on that. You know, there's been talk, I'm sure people have heard about, well, should we move the fall season so that all the sports are before Thanksgiving, because Thanksgiving break, students go home and then they can come back. And that has to do with that protective bubble. And so I'm really agnostic on that. It really has to do, well, are the athletes, are they going to be traveling around and not taking care of themselves, or are they going to remain in a relatively protected bubble? Are they going to stay on campus, for example? Or are they going to do everything right? So a lot of it has to do with the luck of the draw with the virus, but an awful lot of it has to do with whether we're really doing everything right and doing every possible safeguard. And that's what's key. This, again, I can't emphasize enough. This virus, we are coexisting with it for some time going into 2021. It's not like, we're going to have November elections and the virus is going to be gone.
So Brian, we had a recent discussion with Division I on that very subject of, should we move some of the fall championships and try to get them done around Thanksgiving or earlier. And, as you said, no crystal ball. It's a little bit tough to guess about what we should do. We took a survey of the membership, and what they would like for us to do is to wait and kind of see, how the future looks, and if we can in fact predict anything. So, any thoughts about beyond that with if things stay as you see them right now, there's a good chance then that we could get through the regular fall season. With all of the things that you said.
Look, it means a lot of pieces fall into place, and the best thing we can do is take responsibility for our teams, make certain that our student athletes are being leaders for the entire campus. And really, if we do all of that right, that's how the gating criteria were developed. That's our best chance for success. And yeah, it makes sense that we could pull this off. I actually have no problems at all with the membership sentiments that we keep things as they are right now.
And Brian, you broke up a little bit, so I don't know if you referenced that. You were trying to reference this in some of your remarks. You spoke specifically about kind of that bubble and the responsibility for individual campuses to make sure they're taking care of kind of their own house relative to the health and safety of their student athletes. Can you talk a little bit about, though, what does that mean then when in sport, inevitably, we have others coming into our bubble to play, or we're going out of the bubble to play those away from home competitions?
Lynn, that's where we stratify by sport, and for the higher risk sports. So we've had very intense discussions recently about how do you, well, first of all, we think of the inner bubble. So the inner bubble are the athletes and all those who have intimate contact with the athletes, including the officials. And how do we ensure that they're not contagious? Well, the only way to do that is testing. We can do symptom checks and so forth, but for young adults, we know they're often have the virus and they're contagious, but they're asymptomatic. And testing is expensive. I can tell you that there have been some radical changes in testing, even in the last week, with what we call point of care testing, where you have a machine, you don't have to send it out to the lab, you can get results in 10 minutes, and it's not for the viral particle, it's for the antigen, the protein of the virus. It's not sensitive enough right now, but if that really came into being, that would be a game changer. So that's the trickiest part, Lynn, and so this is what we're, I was on a call just before this with another conference. We're develop different testing paradigms, and that's a resource issue, right? Some schools, they can spend $400,000 for their testing paradigm for football, or $140,000 for basketball for a season, but that's at current prices, sending it out to a lab. But again, as testing changes, I think the prices are going to come down dramatically. But we're going to have, certainly well before the season, our different paradigms for how we really help assure that when two teams are competing, they're coming from two different bubbles, that one's a highly contagious bubble going into a pretty well protected bubble. And so that's still to be determined. I can tell you it's even at the professional sports leagues, those are the very active discussions, and it's mostly centered around testing. So that's probably the part that's going to be the most difficult to get right. But I do see real hope there with some of the exponential changes in testing that have happened just in the last couple of weeks.
Let me just offer one thing, that we do have a Q&A. I think that we all have maybe one or two other questions for Brian, but we do have that feature with Zoom. So if anyone would like to write a question into the Q&A piece, we'll be happy to read those to Dr. Inline and have that discussion. I'll just follow up with my last question, Brian, and that is, we're hurrying to make all of these accommodations and things, hoping that we can keep our student athletes healthy and have the seasons. Do you see any permanent changes, either negative or positive, that as we've gone through this? I guess we all hope that the investment and the work, there will be some sort of positive things that will stay with us, but any thoughts about that?
Well, I think a few positive things, Joni. One is, as we started off at the beginning of the program, and we understood that COVID-19 really exposed some really public health, social injustice in our society. We understood that just through COVID-19, let alone the other events that have happened. And so if we can just understand that we really are interconnected, and so that would be a really positive thing. The other is basic hygiene. So, I was an intern at when the AIDS epidemic was just starting. And we had no idea. I mean, we didn't know if it was carried by mosquitoes, and then once we understood it was bloodborne, the whole way that we handle blood since then has completely changed. We do what's called universal precautions. And I think the whole way we do hygiene is going to change considerably. I mean, you go into some training rooms and locker rooms, and it's sort of like a lesson in, a petri dish rather than in hygiene. And that really has to change. And I think this is going to force that change, but it's going to be long lasting. And honestly, that's a really good and favorable change going forward as well.
And thanks. I just had one final question. Coaches associations are communities, just like our teams and campuses are communities. And, it strikes me that in this most unusual and unprecedented time where we need to be creative and nimble, that maybe the best thing that coaches associations can do is be sharing of information and practices that are working and teaching methods that are working. I think we all know, thanks to your communication and medical experts on campuses and conferences, what we need to do. But then how do we teach what we need to do? And how do we make change habits that are, years in the making, so that we operate in a more reasonable and responsible kind of way this year that's very foreign for coaches and for athletes than we've gotten used to in our development.
Well, the one thing I've always respected about coaches, Danny, and of course I've been a product of coach, having been a collegiate athlete, and is that coaches are really data driven, and I think more so than physicians, quite frankly. They try to find out what works and they do it, but this is a little different because we don't have the data, so we're all in this together, and it might seem like I have an understanding of this. I mean, if I have more understanding than you all, I'm maybe a half a step ahead. And what we're doing is so I'm working with experts from around the country and around the world on a daily basis, trying to understand it, and we're constantly sharing and collaborating. And I think the one thing the coaches can do now, in a way that has probably never been done at this level before, is to share their best practices. So you say, I found out a great way to motivate my athletes to really pay attention to hygiene, or I came up with this great functional grouping strategy, let me share it with you. I mean, so you're not sharing your X's and O's, but I think all of us right now can understand that if we're going to get what we really love, and that's sport and for the good of our student athletes. This is a time more than any other that in my 30 years of doing sports medicine, that I think the spirit of collaboration can really be unparalleled. And so it's really a call out to the coaches to help in this regard and to really be the leaders, because I think you all can be.
Thank you, Brian. I concur very much. Thanks for your time today. This has been excellent.
Yeah. Thanks, Joni and Danny and Lynn. Always great to be with you all. It seems like we're seeing each other more than we ever have in at least the 7.5 years I've been here. So, but it'd be nice to be in the same room with you too.
Yeah, well, thanks, Brian, and thanks everyone. And we appreciate your time and continued good health for everyone. And we look forward to seeing you in the fall and all of the other great seasons.